For my son, the issues started day one. As soon as he was born, he just cried all night long. I thought it would get better. I thought things would ease up over time. We were sent home from the hospital because he was completely healthy from a medical standpoint, and the crying just kept on all day, all night. I would rock him for hours on end and finally lay him down, and he would just wake up screaming minutes later. This cycle continued for weeks and weeks and weeks. Shortly after that time, he started developing illness after illness. Even minor colds would take 10 days for him to recover from. He had Coxsackie, he had RSV, he had hand, foot, and mouth disease, always with severe symptoms, always taking a long time to recover. At 4 months of age, he was hospitalized due to yet another illness, an extremely high fever around 104 degrees. He was extremely dehydrated and went through a battery of invasive tests at that time. I'm going to the pediatrician. I'm basically living at the pediatrician's office there all the time, asking her, is this normal? Should I be worried? It feels like he's sick way too often. And she reassured me that some kids just got sick more than others, and his immune system would be strong as a result in the end, and not to worry. So I wanted to believe her. I took my doctor's advice, and I hope she was right. And I just went home and dealt with the continued screaming and crying all day and all night. Around 6 months, ear infections started, and they did not stop for the next 6 months. He basically had continual ear infections that entire time and was prescribed and syringed so many rounds of antibiotics. During his first year of life, he had 20 rounds of antibiotics overall. I saw the antibiotics weren't working. They weren't clearing the infection when we went in for follow-ups. And this was something my first son had dealt with. Ear tubes really helped my first son out a lot. So I started bringing this up to the pediatrician, begging for a referral to an ENT, thinking that ear tubes would fix a lot of the problems that I was seeing in my son. She told me she couldn't give me a referral until my son had had 6 separate documented ear infections. I found out after the fact that was completely untrue, and I could have sought the advice of an ENT at any point in time on my own accord. Around 12 months of age, we finally got the ear surgery done. And by this time, we had noticed a lot of oddities in my son's development. The sickness had continued. He had developed food allergies, and he still wasn't sleeping. He was still crying all the time. He was still a miserable child. We thought the ear tubes were going to fix everything, and he would start talking, start being more engaged in the world, and we were very excited to get that done, but unfortunately, nothing got better after the ear tubes were placed. In fact, everything got worse. After his 12 months checkup, my son began really losing skills and regressing for the first time in his life. He stopped waving, he stopped looking at us. He just completely recoiled into his own world. I really started researching and learning about autism, and it became a concern for the first time. And so I went to the pediatrician and I mentioned this to her. Again, my concerns were dismissed. I was told that he was probably just not talking and he wasn't very engaged because he missed out on so much due to the frequency of illness and the ear infections during his first year. She told me he would catch up. His growth had also fallen off the charts. He was extremely small for his age, but again, she told me not to worry. He would catch up. She told me she could see autism in facial features, and my son didn't have those characteristics. And she also told me because of the way he was clinging to my neck, that didn't look like autism to her. As things perpetually declined over the next month or so, I decided, against her advice, to have him evaluated through early childhood intervention. They came in, they took a look at him, and they told me he was high risk for autism. They noted numerous developmental delays, and therapies were started right then and there. I was under the impression that we were finally getting the help that he needed. Much like with the ear tubes, I thought everything was going to start getting better. I finally have him under the care of experts who are highly familiar with autism and global developmental delays, and I thought they knew the therapies needed to offset those delays and those issues we were seeing. However, he hated therapy. It just pissed him off. It just made him angry, and he still continued to decline. That's when I really began looking into alternative treatments for autism, and dietary changes were one of the first things I came across. Because of this, I took out gluten and dairy out of his diet as a trial run just to see what would happen. And after one day of implementing these changes, he slept through the night for the first time in his life. So I had really high expectations for therapy, as I just mentioned. But the reality of it was they were basically just treating all of my son's issues as behaviors, and they were only addressing it from a behavioral standpoint. And I think that's a large part of what renders it highly ineffective. There was no mention of his slowed growth. There was no mention of the frequency of illness. There was no mention of the high fevers he was constantly having. And nothing was done to address the physiological components of his delays and his symptoms. The whole time I'm bringing all of this up to the pediatrician and asking her, what can be done? I don't feel like he's in a healthy place. And he also had constipation at this time. And she just told me again, this is what some kids experience. This is just the way it is. You're doing everything you can do, and you just need to accept this. When I took gluten and dairy out of his diet and he slept through the night for the first time, I also brought this to the attention of the pediatrician. I thought I was really onto something. She thought it was interesting, and she decided to run allergy panels for gluten and dairy. However, those panels came back negative, and she told me I needed to keep feeding him those foods because of his slowed growth. She didn't want him to lose any weight. She didn't want him to not grow anymore. So she told me I needed to keep feeding him those foods, and that the fact that he slept through the night was purely coincidental. So again, I trusted the experts, and I followed my pediatrician's advice. So within a week of reintroducing gluten and dairy, the sleepless nights returned, the crying escalated, and again, I just trusted that the allergy tests were right, my pediatrician was right, and that was purely coincidental. Over the next 10 months, therapy continued with very little benefit whatsoever. He did finally start walking at 19 months of age, but he still wasn't talking at all. He still wasn't looking at us at all. And this is when I really knew that there had to be more to the story, and really began researching into biomedical treatment, dietary intervention, and learning all I could in those regards. Around this same time, I became pregnant, and we decided to move into a new home, so we had more space. He did fairly well with the move, to our surprise. Shortly after we moved in, though, he got his first case of strep throat. Again, with a high fever, and the pediatrician told me, it was odd to see in a kid that young. That kids 2 years old usually don't get strep throat, so she was surprised that he had it. He was treated with another round of antibiotics, and right around the time he started getting better, he had been on antibiotics for 2 days, and we had a therapy session. And during this therapy session, he was screaming and crying, as he normally did, and suddenly he ran over to the wall, and he threw his head into the wall as hard as he could. And I remember the therapist looking at me, kind of shocked and surprised, and asked me if he had ever done that, which I told her no. And she said, oh, well, he probably has a headache because he's getting over strep throat, so his head probably hurts, and this will probably self-resolve over time. Unfortunately, it did not. That was the beginning of a year of constant self-injurious behavior that escalated both in terms of frequency and severity, and it consumed my family's life for a year.